Talking to your dentist is an important part of any dental procedure. But what if you're unable to speak during the procedure? How can you still communicate with your dentist? The answer is simple: hand signals. In this video, we'll cover everything you need to know about using hand signals for dental procedures. We'll discuss the benefits of using hand signals in the dental office, common hand signals to use during a procedure, how to prepare for a dental procedure with hand signals, and more. So, let's get started. Hand signals are a great way to communicate with your dentist during a procedure. They are a universal language that can be used to communicate basic information, such as when to stop or start the procedure, and can also be used to convey more complex information. Hand signals have been used in many different fields, such as in military, sports, and the medical field. In the dental field, hand signals are used to communicate between the dentist and the patient. They are a simple, non-verbal way to communicate during dental procedures. Hand signals can also be used to reduce the anxiety that some patients feel during a procedure. When a patient is unable to communicate verbally, hand signals can provide reassurance that their needs are being met. What is the benefits of using hand signals in the dental office? Using hand signals in the dental office can be beneficial in many ways. First, they provide a simple way to communicate between the dentist and the patient. This can help to reduce anxiety in the patient, as they can communicate their needs without having to speak. Second, hand signals can help the dentist to better understand the patient's needs. When a patient is unable to verbally communicate, hand signals can provide insight into what the patient is feeling or experiencing. This can help the dentist to adjust the procedure accordingly. Finally, hand signals can improve the efficiency of the procedure. By communicating with hand signals, the dentist and the patient can work together to ensure that the procedure is completed in a timely manner. This can also help to reduce the amount of time the patient is in the chair. Let's take a look at the common hand signals to use during a dental procedure. There are many different hand signals that can be used during a dental procedure. Some of the most common hand signals include raising your hand. This is a universal sign for stop. If you need to take a break during the procedure, raising your hand is a simple way to communicate this to your dentist. Pointing to your mouth. This is a sign for pay attention to this area. If you're experiencing pain or discomfort in a specific area, pointing to it can help your dentist to focus their attention on that spot. Thumb up, thumb down. These are signs for yes or no. If you're asked a question during the procedure, using these hand signals is an easy way to answer. Waving your hand. This is a sign for I'm done. When you're finished with the procedure, waving your hand is a simple way to let your dentist know. Make a fist. This is a sign of pain. When you're feeling pain, making a fist is a way to let your dentist know that you're in pain. The OK hand sign. This is a universal sign for I'm OK, to let your dentist know that you're okay and to continue the procedure. To sign hurt. Take your two hands and make each into a fist with your index finger extended. Point the index fingers of each hand at one another and twist the two hands back and forth in opposite pivots to let your dentist know if it hurt little or a lot. I want to talk. To sign talk, take the four fingers on your dominant hand and tap them repeatedly on your chin. To let your dentist know that you want to rinse or suction your mouth, use this hand sign. To let your dentist know that you want to scratch your face, use this hand sign. How to prepare for your dental procedure with hand signals? Before a dental procedure, it's important to make sure that you and your dentist are on the same page. This is especially true if you plan on using hand signals during the procedure. Every dentist should be well versed with these signs and signals, as he has to respond to the patient's signals immediately by understanding what the problem is during the procedures. It is also important to teach the patient before each procedure what exactly hand signals mean and what each one conveys, giving patients pamphlets while they are waiting their turn, or putting up posters in the waiting area and asking your receptionist to explain it to the patient and ask them to memorize these signs and signals will be very useful during dental procedures. What is the troubleshooting difficulties with hand signals? Using hand signals in the dental office can be a great way to communicate with your dentist. However, if you're having trouble communicating with your dentist, you can also try speaking up. Even if you're unable to speak during the procedure, you can still make your needs known by speaking up before or after the procedure. Finally, mastering hand signals for dental procedures can help to ensure that you and your dentist are on the same page. It can also help to reduce the amount of time you're in the chair and make the procedure go more smoothly. So the next time you're at the dentist, Don't forget to use hand signals.